When you are about to give medication to someone, you want to wash your hands so you are not transmitting any bacteria that may be on your hands. After you have washed your hands, you want to go into the patient's room and introduce yourself and ask if you can perform any necessary procedures that you may need to perform. Hello, Mr. Bunny. My name's Allison, and I will be your doctor today. Do I have the permission to perform any necessary procedures? Yes? Thank you. After you've consulted with your patient, organize any equipment that you may need and read the medication order after you've done necessary procedures. The medication order that we have been given is to give 125 milligrams of Ilozone by mouth every morning. This patient has an ear infection, and Ilozone is used to treat infections. After you have read the medication order and know what you have to give the patient, check the patient and ask if they have any allergies that may be in the medication for them not being able to have it. Mr. Bunny, do you have any allergies? No? Perfect. Now that Mr. Bunny doesn't have any allergies, if you do not know what the drug is that you need to give, go to another separate room and research what it is. Now that you know some side effects of the drug that you're about to give the patient, check the drug order one more time to make sure that the bottle you have is the correct drug and you know how much to give. The order says give 125 milligrams, and in this bottle it is 250 milligrams. So we will be giving the patient a half a tablet. Check the expiration date to make sure that the pills aren't expired, because if they are expired, then they won't have the effect that you want them to have. These pills expire in 2 years later than now, so they are okay and they have 2 more years that we can use them. 4, to give out the medication, you want to open the lid, place it upside down, and then perform a second check just to make sure that it's the right drug that you need. And now that you have the right type of medication and it is measured to the perfect amount you need to give them, take the medicine and make sure that you have the right one again. You are going to be checking the medication 3 times to make sure that you have the right kind. Now that you know that you have the right kind of medication, make sure that you have the right patient. Go to the patient and check their wristband and ask them what their name is and their birth date to make sure that the medication is not being given to someone that it shouldn't be. When medication is given to someone that it shouldn't be given, it could have harmful effects on you, the doctor, or the company that you are working for. Also the patient, because they may become more ill than they previously were. Hello, Bunny. Are you Mr. Bunny? Yes? Okay, let me make sure. Yep, you're Mr. Bunny. Alrighty, now that Mr. Bunny has been identified as Mr. Bunny, give him the medication and then some water to be able to drink it. Here you go, Mr. Bunny. Take a half a pill. Some patients might not be able to take the medication on their own, so you might have to help him. You need to stay there no matter what to make sure the medication has been swallowed. I'll help you, Mr. Bunny. Then some water. Good job, Mr. Bunny. Good job. After the patient has taken the medication, you need to wash your hands again before you return and go talk to or interact with any other patients in the facility. The way to pour a capsule is to take your bottle, take your cap, and just pour it into the lid. If you get too many, that's okay. Just take your lid and pour it back in until you get the desired amount. And you can keep going in case you don't get it on the first try. There we go. Now that we have the right amount, we want to check it again just to make sure, because we don't want to give the person the wrong tablet. After you have left the patient's room, make sure to document the procedures that you performed and report any observations that you may have found while you were in the patient's room.